Welcome to this webinar on acupuncture and Chinese medicine. We are so excited to have you with us today. My name is Luke Phillips. I am the Assistant Vice President for the School of Professional Studies, and we are really thankful to be joined by Dean Jenny Yu, the Dean of the College of Eastern Medicine, which houses our Doctor of Acupuncture and Chinese Medicine program. So today on this webinar, we're going to cover a lot of really exciting things. So I really encourage you to stick through all the way to the end. We're going to talk about the program that we have and kind of our really unique philosophy and the approach that we have toward acupuncture in an integrative environment. Also talk a little bit about what's happening in the acupuncture industry and give a little bit of insight at the end. If you're a prospective student or want any more information, we will also give you some information about that as well at that point. And so a few quick things before we get started though. If you are listening on this webinar, if you have any questions during the live webinar, there's a button toward the bottom where you're able to click and enter in your questions in the chat box. So if you go ahead and do that, we will try to respond later on in the question and answer portion. And if we're not able to do that, we will get back to you with an email. If you're watching this on YouTube, where it's going to be posted later on, you can just go ahead and put your comments there, or you can just always email admissions@scuhs.edu and we'll be sure to get your questions. If you can only watch for a portion of time, or you want to share this with someone else later on, it will be posted at youtube.com/SCUHS. And then if you want to just learn more about us, learn more about our program, you can go to scuhs.edu/DACM and learn all the information you would like to find there. So with no further ado, I want to pass it along to Dean Yu to get us started.
Thank you, Luke, and welcome to this webinar. I'm very excited to share this hour with you. And our goal today is to introduce you to our program, our unique program, as well as the current status of the acupuncture and Chinese medicine in U.S. healthcare. So let's go ahead and begin. And if you have any question, please feel free to type in and we will answer your question accordingly. And so to begin with, I am Jenny Yu. I am the Dean of the College of Eastern Medicine at Southern California University of Health Sciences. At SCU, we have a very unique program, and we acronym it as DACM, the Doctor of Acupuncture and Chinese Medicine program. So as you can see on the screen, this will be our outline of the session. I would like to give you a brief introduction of our institution and what do we do here and how is our program different, and what is going on with the healthcare landscape in the United States at this point, and the rising of acupuncture awareness, and some collaboration and opportunities with other institutions or affiliations. Okay. We believe here at SCU, we believe that the excellence in healthcare begins with the excellence in education. So it is our highest priority to provide the best education that we can to train our students to go out there and provide their service to the community. At SCU, and you can see on the screen, there is our website. So if you have any question or any interest, you can go ahead and log into the website and you can find a lot of our information on there. We are located in a very quiet neighborhood in Whittier, California. Whittier is a very interesting location because within about 30 minutes drive, you could head to the beach, head to the mountain, and a little bit more, you can even head to the snow. So this is definitely a very good location for students who would like to study, at the same time enjoy recreation. SCU is established in 1911, so we are a century-old institution. We are a private, not-for-profit institution. The vision of SCU is SCU will be recognized as the premier evidence-based integrated healthcare university. And our mission is to educate students as competent, caring, and successful integrative healthcare practitioner. With that said, these are the screen you're seeing right now are some key points to our institution. We would like to promote and advance excellence in healthcare education, and we will discuss that throughout our webinar. We integrate traditional Chinese medicine with modern science and research. What that means is, for those of you who know a little bit about acupuncture and Chinese medicine, it is a very old medicine that exists in the world. It is not the oldest per se, but it is certainly the oldest survival. Before that, there's probably the Egyptians, the Incas, the Mayans. There are a lot of other medicinal system. However, traditional Chinese medicine, TCM, seems to be the oldest survival medicine system currently. And very interesting, if you think about that, it started from China, and now we're in the United States talking about this medicine. So it traveled 6,000 miles across the ocean, and it made through centuries and centuries, now to 2018. So it means that it survived the test of time and the test of distance, and it could only be meaning one thing is because it works. So at SCU, we honor the tradition as well as embrace the modern. So this is what we put into our education to our students. We facilitate Eastern medicine and Western medical concepts. We provide ample resources for faculty and students. For comparing to the universities of our kind, we do have the state-of-the-art facilities and health centers. So we really welcome you to come and tour our campus facilities, and then you will know what we're talking about. We have a very strong alumni network, and we have a very sound external affiliations as well. We have 4 colleges here at SCU. We have the Los Angeles College of Chiropractic, we have the College of Eastern Medicine, we have the College of Science and Integrative Health, as well as an SCU Health System, all hosted on campus. We are the only university that simultaneously are accredited by WASC, which is the Western Association of Schools and Colleges, ACOM, which is the Accreditation Commission for Acupuncture and Oriental Medicine, CCE, the Council on Chiropractic Education, as well as RPA, the Accreditation Review Commission on Education for the Physician Assistant. Therefore, we are very unique, and in addition to that, SCU's DACM program is so far the only Doctor of Acupuncture and Chinese Medicine program approved by the California Acupuncture Board. SCU provides several degrees ranging from certification, bachelor's, master's to doctoral level. And SCU hosts a lot of programs. As you can see, we have the Acupuncture Chinese Medicine program, Chiropractic, Physician's Assistant, Biological Science, Accelerated Science courses, Ayurveda, Massage Therapy, and continuing education opportunities. I would like to also introduce you a little bit to our health system. Our health system is composed of 2 parts. One is the Community Health Center, and the other is the Center of Excellence. For our students, of course, our ultimate goal for our student is to be a sound practitioner of healthcare providing to the community. So through the curriculum, the students will be doing their clinical training starting with our Community Health Center. Our Community Health Center provides services of acupuncture, Chinese medicine, chiropractic, Ayurveda, massage therapy, as well as the joint rejuvenation. We call it the PRP treatment. The Center of Excellence, we have the diagnostic imaging, spine care, sports medicine, and human performance. Our health system has featured in several times in the Orange Coast magazine as the top doctors. And that is, we're very happy about that. SCU has also been named a White House Healthy Campus. we were among one of the several campuses that was invited by White House actually to visit White House because we provide an environment that is in aligned and in commitment to foster a healthy campus for all students. A little interesting story here is, if you could see, there's a picture on the upper left-hand corner. We have a student in a white coat holding a certificate. She is Julie Lau, who was our ASB president, Associate Student Body president. So she was, she headed to White House to receive this honor. However, during the time that she headed to White House was the same time that she was supposed to be on campus participating in her white coat ceremony. So unfortunately, she had to miss that on campus. So White House found out about that, and they actually coated her in the White House when she was there. So that is a tremendous honor there. So let's jump into a little bit about what exactly is traditional Chinese medicine and its advantage. TCM, traditional Chinese medicine, sees and understands the whole patient pattern. So if you think about that, our body consists of many parts, many organs, just like a team. So it functions like a team. Therefore, when we have conditions or symptoms to our body, we really need to look at it as a whole. Just like a machine, every single nails and screws have its function. So therefore, we really cannot disregard any parts of our body. So that is one beauty of a traditional Chinese medicine, is we evaluate the patient as a whole. We also customize and individualize treatment. We do not have a cookie cutter kind of standard of treatment. We evaluate every patient at every visit and determine what is the best for that patient on that day. So therefore, we don't really have a one treatment for all kind of say. TCM rarely have side effects when managed properly. And this is very important because we have heard, we often heard that, oh, acupuncture is very scary. It doesn't work, it was wrong, something happened. So we really need to look at the treatments being administered accordingly and properly. And that goes back to the concept of a whole patient and individualized. We really need to evaluate every single patient in order to provide the best treatment for that patient. So in other words, what works for me will not work for Luke, and vice versa. TCM acts as a preventive medicine. So in healthcare right now, preventive is a very, very big word. We would like to prevent things from happening if we can, instead of let it happen and catch up. So TCM is a very, very effective way to maintain our health and prevent our body to go into conditions as much as possible. It also has a very long and clinically verified history of effective treatment for most types of diseases. It is actually still the main medical system in Asia up until around 1950s. So therefore, the length of time of its existence has pretty much proven its efficacy in its own. And it is an empowering system of medicine because we work with the patient. So it is not a type of treatment where the patient just receives. Every patient must be a part of the treatment in order for it to work. Just like working out. So if a patient would like to, if somebody would like to lose weight and achieve a ideal weight, it is between the person and the doctor and maybe personal trainer. So everybody plays a part. It cannot just be one or the other. So let's discuss a little bit about the Doctor of Acupuncture and Chinese Medicine program at SCU. From here on, we're going to call it DACM program. So why is it unique? I am very happy to share with you that the first licensed DACM practitioner in the United States is our graduate, Dr. Megan Gray. She is currently practicing in Colorado. We are very excited about this. We're very excited to elevate the standard of education in the United States by providing this program. The difference between DACM and a general understanding of the curriculum is that the DACM at SCU is a first professional entry-level doctorate program. What that means is you will not need to go through a master's and then a doctorate. You actually enter as a doctor and you graduate as a doctor. This is currently the only program in the West Coast accredited by the Professional Accreditation Agency, ACOM, and California Acupuncture Board. This is the only program in the United States currently being approved by the California Acupuncture Board. The program consists a minimum of 3,870 hours, 211 units, and it is approximately 3.5 years. We call it 10 terms. We have 3 terms in a year, so it's approximately 3.5 years. From the program, the student will have to participate at least 1,050 clinical hours in 4 different phases. The DACM provides a robust basic science courses and it is currently the only program that offers a cadaver lab. On the image, you can see that is what we call the anatomosh table. It is pretty much like a giant iPad where the students can actually practice and learn about human anatomy in a human-sized kind of machine, like an iPad, where it is very, very interesting. And SCU has one of them. From my understanding, there's only a few in the United States and we house one. Therefore, SCU provides a really unique learning experience to our DACM students comparing to many other programs. DACM, we integrate learning experience alongside students of various health programs. At SCU, we have several colleges. So the first 1.5 years, the students will sit alongside with our physician's assistant students as well as our chiropractic students. So here on campus, we say that we learn from, with, and about each other. So what is the benefit of that? The students, instead of waiting to go out there and learn about different systems, the students are already very familiar with each other while they are in school. And they also practice their clerkship together in the health center. They learn how to incorporate each of their knowledge in benefiting the patient's health together while they're in their clinical training. Our DACM students have the opportunity to do their clinical clerkship off-site at several locations, such as the Oncology Institute of Whittier. That is an integrated facility that sees mainly the oncology cancer patients. So our students get to see how the oncologists work together with them and incorporating acupuncture to the patients. Very exciting is the Children's Hospital of Orange County, so-called CHOC. SCU is the only program that CHOC is affiliated with, allowing acupuncture students on their site, as well as California State University Fullerton in their student health center. SCU DACM program consists of a capstone project. And one requirement of our program is that we would like our students to practice evidence-based practice of healthcare. So every of our students need to complete a capstone project by their graduation time, and the integrity of the project must be a publishable work. And a student can select a concentration track. Currently, we have orthopedic, healthy aging, as well as nutrition. So each of the student can select one of those to as their concentration. And DACM incorporate more classical foundation courses in our curriculum comparing to many other programs. Just like if any British literature major, they should really know well about their Shakespeare. Our DACM students also have the opportunity to work with our sports medicine department, which they also have the opportunity to observe at the US Olympic Training Center. That's very exciting. They can also study abroad. We currently have several affiliations in China and Taiwan. Very proud to let you know that just a few weeks ago, 10 of our DACM students visited the Shandong University of Traditional Chinese Medicine in Jinan. That's in the Shandong province in China, where is the hometown of Confucius. And they completed a 10-day intensive study. And actually, that is actually their picture there that you're seeing. These are the national and international collaborations with SCU. So we have our locals and we have our overseas institution that we work with. And our students have opportunities to visit these institutions for additional training. SCU offers a lot of scholarship opportunities. We have a small amount of scholarship to a full ride scholarship according to qualifications. Compared to many other schools, this is one thing I'm very excited about our program is we offer many student clubs and organizations on campus because we not only want our students to have a great education experience, we also want them to enjoy life and their student life. So as you can see that we have a yoga club, we have intramurals, the volleyball, meaning different terms, they have teams and they compete with each other. There are many student clubs on campus. SCU also offers a campus environment. So this is actually a true photo of our campus. We have an outdoor environment for our student and not just inside a classroom all the time. Okay. So let's discuss about what's going on with the healthcare landscape in the United States. Currently, the healthcare is going through a reform as well as higher education in the United States. So how do we bridge the gap? By delivering patient-focused integrative healthcare and by providing a student-centered interprofessional education to our students. And these are very important concepts. So what do we do here? Look at that. This is a valley, and then there's two sides to the valley. And for many centuries, the two sides have been working individually on their own. So SCU is bridging the gap by mixing them together because we do believe that every profession offers their expertise. And if we could incorporate them together, I think that will bring the best to our patients. Dr. John Scarinch, our president, this is his quote, "We are changing healthcare one student, one patient, one practice, one community at a time." So as you can see, we are transforming education through healthcare and from a caterpillar to a butterfly. As you see on the screen, SCU currently has a Doctor of Chiropractic program, Doctor of Acupuncture and Chinese Medicine program, the Masters of Science, Physician Assistant program, and perhaps a future Doctor of Naturopathic Medicine. Our goal is to educate all the students together from, with, and about each other, having a core curriculum of the basic science, so they are trained at a standard level, sitting together, and learning their same competencies. So by the time they graduate and they're ready to go out there and work, they are already familiar with each other and what they do. Because very likely, going forward, there's not going to be just a one type of health service to a patient. It's going to be an integrated. So these students are already very comfortable, very knowledgeable about each other, and that is a great benefit to the patient. And that is what we call the integrated healthcare. Okay. SCU, we're trying to move from the concept from what is the matter with our patient to what matters to our patients. We have a saying here that the patient is above all. So at the end of the day, everything that we do is to offer a better service to our patients. So we would really like to move introduce the concept to our students about what is called the patient-centered care. This is a article on the Harvard Business Review. It is called the Value Agenda. Currently, the U.S. healthcare is a lot of people call it broken. In many ways, it is too expensive, not affordable, and too complicated. So if you look at the very top of this picture, organized into integrated practice units is the starting point. So at SCU, this is our goal. We train our students to be able to fit into this integrated practice unit module. So when our students graduate, they're ready for the coming up healthcare. Acupuncture has only been in the United States shortly over 40 years. So even though 40 years seems very long to many of you, it is actually not. I do want to use this opportunity to share with you a little bit about how acupuncture got to the United States. So it was in the early 1970s when President Nixon visited China. So along with him, one of his crew members developed appendicitis in China. So of course, immediately he was sent to the hospital to get surgery. So while during the surgery, President Nixon was watching it, and he noticed that during the surgery, the patient was awake. So if you can imagine somebody is cutting open your abdomen and you're still awake and your face doesn't show any pain. So President Nixon was very impressed and he was asking what's going on. So the hospital introduced him to, oh, the patient did not have a full anesthesia. The patient actually had acupuncture anesthesia. So that was when President Nixon learned about acupuncture and he said, then we should have this in the United States. So that was when he brought acupuncture back in the United States. Acupuncture was then introduced to the United States and officially became a profession in 1975. And currently we're in 2018, so it's actually just a little bit over 40 years. So you imagine within the 40 years, it went from a completely new, unknown, and very new profession to what is that? What do we do with the needles poking in people's body to currently it is being offered in the mainstream hospitals. It means that acupuncture really came a long way. I went to an event just 2 days ago at the Children's Hospital of Orange County, CHOC. They featured a documentary film called Getting to the Point. So if you're interested about that, you can log on to acunow.org. That is the Acupuncture Now Foundation. And you can see the introduction to that film. A few weeks later, in May, the entire documentary will be available in that website. So basically, it was a documentary film about several patients that are treated at CHOC by the neurosurgeon, Dr. Loudon. Their experience on how to incorporate acupuncture to better help these children. And the families and the patients were actually there and present, and you can hear what they have to say. So you can actually see and feel what acupuncture is offering to these patients. So this is a milestone for the profession. And I would call it the rising of acupuncture awareness, that major hospitals, major institutions are aware of the effectiveness of this treatment modality, and therefore the demand is in a high rise. So we could only picture that we need many, many more of the practitioner down the road to help the patients. So I welcome you to log into that website and take a look at the documentary. So last but not least, I would like to share this quote with you by Roy E. Disney. When your values are clear to you, making decisions become easier. So I'm sure if you're interested in joining me in this webinar today, you must have thought about what can you do or how can you provide the benefit to people, to healthcare. So there must be some decisions that you're going through right now about your future. Like we just mentioned, acupuncture is on the rise, and we hope to see you at our school, at our program, and looking forward to working with you in providing healthcare to the patients down the road. Thank you. And now we're going to give it back to Luke.
Okay, everyone. Thank you so much, Dean Yu. We appreciate you giving us that overview. And for all of you who are on the webinar or watching on YouTube, I encourage you to stick around for a few more minutes because we're going to talk about really quickly the process for enrolling into our program here. It will only take a few minutes, and then we're going to get into the really exciting stuff with just some question and answer time, a little more about acupuncture, what's happening in the industry and that kind of thing. So really quickly, if you've joined us and you are joining because you wanted to learn more about the program and you're interested in potentially applying, I would really encourage you to go ahead today. If you do it now, you can go to scuhs.edu/apply and use code WAIVER in all caps, and we will waive your $50 application fee. That application, most people, it takes them 10 to 15 minutes. It just helps us to get the information about you, what schools you've gone to, and some of your background. And then we can get you in the process where we can connect with you and help give you more information about the program, answer any questions and that kind of thing. So no matter how far away the next start date is, or no matter how far along you are in your education, if you have any interest to ever do a program like this in the future, we would strongly encourage you to go ahead and fill out that application. Once that application is complete, we would then need to get your transcripts. They can even be unofficial transcripts, so we could just do a preliminary evaluation. So we don't have you do all these steps. We don't have you fill out a lot of stuff. You don't have to send in your copy of your driver's license or anything like that yet. The very first step is just get those transcripts in. We can do a quick evaluation and help determine admissibility. And then from at that point, the next step is the interview, the acceptance. Then there's just this $250 non-refundable deposit. And at that point, you're now part of the cohort, and you'll get all the information about orientation and the syllabus and everything you need to get started in the program. We have one of definitely the largest for this DACM program, the largest cohort coming up this year. And we're very excited for that to continue to grow and to continue to build this amazing community of students on our campus for all those who are enrolled. If you're wondering about what the requirements are, those are all on our website, but I'll tell you just really quickly. It's just the 90 semester, 150 quarter units from an accredited college or university, also 2.75 GPA and 3 semester units in biology. That's 4 quarter units in biology. And again, if you do that transcript evaluation, we can always take a look at that for you and help determine admissibility and that kind of thing. And so speaking of the requirements and speaking of the program a little bit, I do want to ask Dean Yu one question, and I'm going to go ahead and stop sharing the screen so we'll get to where you can see us a little bit better. But about the program, so we've talked about there are so many things you learn in this first professional thing. We talked about all the things that are kind of required, but one thing unique about this is because it's a first professional program, you actually don't have to complete a bachelor's or a master's degree in order to begin the program. It's just those 90 units. And how is that we're able to do the doctorate without the other things before it?
Well, that's a really great question, Luke. So first of all, if you think about that, it's you're saving a lot of time on that. But it doesn't mean because you don't have a bachelor's or master's, then you wonder, oh, are you getting any less? No. During the curriculum is very intense and robust. So within that, within the duration of your curriculum, you will learn all the competencies that is required for you to become a doctor of acupuncture and Chinese medicine. You're going to learn extensive neuromuscular and orthopedic testing. So it's no doubt that this program is not giving you any less. So if you think about that, is actually a great way to as early as possible to complete your education and go out there and service the community. So without having to go through different loops and then different application is once you get into the program, you will start as a doctor and then you will complete as a doctor.
Mm-hmm. Yeah, and so really we get that question a lot of people who are used to that, how it used to be, where it used to be you had to do a master's degree, and then if you wanted a doctoral degree, you would have to then do a post-master's doctorate also.
Yes.
And it used to be also that you could only be licensed if you did that master's, but now it's a great value to the student because you can actually just kind of do it all in that one first professional doctorate degree.
Yes.
Which is very exciting. And so thank you for that. Now you mentioned we have this trimester system, so you're actually doing 10 trimesters, 3 per year over the course of your time with us. And what are some of the things that you would kind of experience in the curriculum from like term 1 through 10? I heard the other day that they actually start needling in the second term, then they get into the clinical portion. So can you tell us a little more detail of what they'll learn?
Yes, the DACM program is designed to incorporate classroom learning and hands-on as intensively as possible. So as early as the second term, the student will be practicing the acupuncture technique. Well, of course, you're not practicing on patient yet. You're actually practicing in a supervised classroom environment. As well as the second term, the students start observing in our University Health Center. So what that means is that there's a lot of philosophy and theory to learn. So you really cannot put it into sense unless you are hands-on and observing the real practice. So that's why when we design the curriculum, and different than many other programs, is we try to have our students to really engage in what it's like to a real treatment as early as possible. So the DACM curriculum worked this way. There will be a bit more of classroom sitting at the beginning of the program and shifting to more of the clinical training toward the end of the program. So as early as the second term, student will start observing and in different phases and progressing into an actual hands-on clinical student.
Mm-hmm. And they also get to learn not just the needling and that kind of thing, a lot of basic sciences, clinical experience, and also learn herbal medicine, right?
Yes.
Can you tell us more about what they learn in the herbal pharmacy and herbal medicine?
Yes. So our curriculum, even though the name says acupuncture and Chinese medicine doctor, it is not just about acupuncture and Chinese medicine. We also need to teach our students about basic science concepts. So our students are very, very well trained in the basic science concept at the beginning of the curriculum. Acupuncture, of course, is the main modality that students will be practicing on because that's what the patients would be asking for. Our students also learn herbology, how to formulate herbs, how to identify herbs, and how to use these herbs to help the patients in conjunction with acupuncture or actually one or the other. Our students will have to rotate through training in our herbal pharmacy, which is housed in our University Health Center, to actually formulate herbs for real patients. So our students get a pretty rounded training, and not just acupuncture, there's also what's called cupping. If you would like to look on the athletes, for example, our gold medalist, Michael Phelps, he had these round marks on his body when he was at the Olympic Games, and that is called cupping. And that is one of the scope of practice under the acupuncture license in the United States. So our students get to learn that as well.
That's wonderful. It's a very comprehensive kind of curriculum. It's really kind of cool to see. They also learn, correct me if I'm wrong here, but there's several kind of practice management kind of things, because a lot of times those who are learning medical disciplines, you learn a lot of science and that kind of thing, but really what you end up doing is opening a business. You're going to start and run your own practice. So we have a few practice management courses that would end up taking. Is that right?
Yes. In our curriculum, we have 3 practice management courses, and these courses are taken together with the students from the other programs. Again, that is our integrated classroom setting. To be a successful practitioner is not only about the knowledge of the scope. The practitioner also need to understand how a business run. So our curriculum have 3 practice management courses that is given in phases at different terms. There are different level of introduction. For example, there are introduction about how to set up a practice. There is introduction about risk management, and there is another course about insurance billing and coding, because if a practitioner puts down the wrong code on their insurance billing, they might get denied, which means they will not get reimbursed for. So these are all very important concepts that we add into our curriculum besides the concept and theory of the medicine. So it is a very well-rounded curriculum per se.
Very good. And thank you to all of you who are on the webinar right now. We have some really good questions coming in. So I'm actually going to ask a few of them real quick about that came straight from the watchers right now. And then if we're not able to get to every question, we will email you with the answer after the webinar. But someone said, I have no science education. Can I still apply? And I think we would say, yeah, of course, yes, you definitely can. We strongly encourage you to do that. And if you had an interest in learning some science before, we also have accelerated science courses that people from all over Southern California, every 4 months, we have over 1,000 students who come here just to take these courses. So we have over 25 accelerated science undergraduate level courses that people use for GPA booster. They'll use it for just brushing up on their sciences or to fulfill their prerequisites for medical school or for other things. So if you felt like a little inadequate and you wanted to talk about that with a counselor, I encourage you to email admissions@scuhs.edu and we can get you the information you need. There is that 3 semester units of biology are required.
Yes,
so
general biology.
That general biology requirement. Another question is, what are the average hours for classes on a given day?
The DACM program runs a bit more intensively at the beginning of the program. So be ready for the first 3 terms. You're probably sitting in classroom many hours during the day. I would say probably 6 hours or so on a given day at the very beginning of the program. Toward the later of the program, then your time is mostly spent in seeing patients in the clinic.
And we do try to set the expectation for the students. It is a very much a commitment. It's a full-time program, so we wouldn't say you could have wouldn't be easy to have like a full-time job or something like that while trying to do the program. The students are pretty much their entire period of their life for those 3 1/3 year is focused on the education. So try to have that expectation as clear as we can. Also,
but actually, Luke, can I just share a comment? Even though the hours might be long and the clinic hours might be long, our students really enjoy doing it. So I guess when you really enjoy what you do, hours is not a matter.
Mhm. Oh yeah, definitely. And our students love being here on campus. Dean, you talked about the campus experience, and so while you're learning a lot, you're also getting to know each other. And what I've observed is I've seen we have a PA program, we have a chiropractic program cohort, we have massage therapy students, Ayurveda students. Well, of all the programs we have, I think the acupuncture students, it's this family-like environment where you're getting to know each other, and these are people who you'll have relationships with for the rest of your life.
Yes.
Which is a really cool thing. And then also you get to meet Dean Yu and the other faculty, and it's just a really great kind of family and great experience on campus. Talked about the different opportunities for involvement. We have over 25 clubs and associations. Students can be very involved, and I think our last two presidents of the ASB were both in the acupuncture program. Is that right, Kenny and the one before? So we've had a lot of involvement from the acupuncture students in our leadership of the university as well. It's just kind of
our CEM is very much like a family. Most of the faculty know the student by first name. We have a very small ratio. It is really very close, like a family.
Mm-hmm. And Joe asked, he said, is there a preview opportunity? So one thing I will tell you is we do have a campus preview day 3 to 4 times per year, and then we also have open houses every several months. So in addition to the webinars we do, we give a lot of opportunities for those who are close by, or even if we have a lot of people who come from far away to take part in that. Campus preview day it's always just on like a Saturday morning, and it's a great opportunity to see demonstrations. You get to go through our clinic and that kind of thing. And if you're interested in something more in depth, like shadowing or those kinds of things, we've done that in the past before as well. So we can work that out potentially if you email us also. So very good. Now, what would you tell us about, Dean Yu, the job market? We talk about here at SCU that we're preparing today's student for the healthcare system of tomorrow. And sometimes people think, oh, acupuncture, that's a medical practice of yesterday. But really, this is what's the future for healthcare and the job market, and there's so many things you can do. So you tell us about that?
Yes, that's a great question. Thank you, Luke. It is not a secret that is a big news that people are talking about is the opioid crisis. So what that means is currently in the United States that many people are taking many drugs, and very often the drugs might not be necessary for their condition. And so perhaps this is one reason why acupuncture is on a very fast and speedy rise, because it is needed. Its efficacy has been proven through research and through time. Like I said, this is 1,000-year-old modality. And so the job market for this profession can only increase because of demand. Looking at insurance reimbursement per se, now acupuncture is reimbursed by most of the major insurance company. Acupuncture is actually adapted under the so-called Affordable Care Act. It is a covered benefit in the state of California. So these are all indicators that there is only going to be more demand of this medicine from here on. So we can only project that more people are going to need, because it's not a secret that people are only going to be have more health conditions based on the lifestyle that we have, based on the food that we eat. So I always tell my students, I think they'll never run out of job. They will always, the patient number is only going to increase. For example, the Children's Hospital of Orange County, they currently have 2 acupuncturists there. One is our faculty, one is our graduate. And so I really think that as the awareness is rising, integrative practice is rising, acupuncture is definitely going to have a higher and higher demand.
Definitely. And as the industry grows, there's demand for students. And and it seems to me that our alumni haven't had any problems in the past with employment and that kind of thing. We've really had a really great rate of success with our students.
Yes.
getting into the workforce?
I get a lot of calls. I can't say on a weekly basis, but pretty frequently I have calls from people that I don't know. They just look up on the website, they found us, and because we are an accredited program, they call us and they get to me asking for referrals to hire. They could be medical doctor's office, chiropractic office, different healthcare practitioner office. They all want to have acupuncture join in their facilities, and that's really good to know. And then so I reach out to our graduates, and no kidding, most of them already have their own job that they like. So actually I have more demand than supply at this point. So that's a great news to share with you.
Yeah, that's really good. And we've seen a lot of success in that area. And one of the things is, Dean, you talked about that integrative mindset that's becoming more and more prominent, this healthcare delivery system of the future. And with that, that's going to create more demand because you have more medical doctors and more chiropractors and others who want to integrate. So they want to integrate things like acupuncture in their practice and that kind of thing as well. So still on the rise. A very good question that we got there. Another question I see around transferability and that kind of thing. So if you're at a current, say, school and you're interested in transferring in, or if you had been a practitioner of a different kind of practice, we see a lot of, especially chiropractors, who are currently practicing, but they want to add acupuncture into their own skill set. So if you do that, we would ask you to go ahead and fill out the application like everyone else would do online. That's scuhs.edu/apply. And then we evaluate your transcripts and the courses you've taken for advanced standing and the transferability. So there's a good chance that, a number of your courses could then transfer in. So that's a good question. Thank you for asking. Keep those questions coming, and we'll keep answering as many as we can before our time's up here. One thing, Dean, that you mentioned is that it's based on evidence and science. And I think that's a really important thing. At school, one of our the core values is evidence-based.
Yes.
And then focused on outcomes and that kind of thing. Can you tell us more about some of that and what some of the evidence and things that have been out there in the past?
Yes, this very interesting topic and question, actually, this was in one of the discussion at a hospital, at the children's hospital, is a question came up was, since acupuncture and traditional Chinese medicine is such an old, ancient modality, what has changed? What brought it to people's awareness? And we, the practitioners at the conference at that time all agreed that it is because of evidence-based. What does this mean is, we can't just go around and tell people that, oh yes, acupuncture works. We really have to prove it, and through data and through confirming and reconfirming. So that is what we teach our students to approach that way. So there is a confirmation and information provided for the peace of mind and for the patient education for the public. SCU evidence-based is one big theme at SCU because we really want to make sure that what we're giving to our patients, what we're teaching to our students is really the best.
And it's the highest academic standard. So
Yes.
She talked about being we've been regionally accredited for over 20 years, which includes the acupuncture program by WASC, which is the same accreditor that accredits Stanford and the UC system and lots of things like that. Also approved by the main accrediting body, ACOM,
Yes.
and the only doctorate approved by California Acupuncture Board. So if there's ever a question on the academic standard and rigor, that's definitely something that's what those accrediting bodies are for. They look at those kind of things. We submit the curriculum, and you don't get those approvals if there's not the evidence and if it's not a program at the highest standards.
Even up to the national level, NIH, WHO, they all have evidence showing that this medicine is very effective.
And we're going to go, we had scheduled for an hour, so if you have to go, it's okay. We might go over a little bit because we have such good questions coming in. We're having such a good time. But I'm going to ask, I think, at least two more things. Can we dive into the clinical experience a little bit more? And it's kind of like at what point, I know you said they start observing early on, but then later get into the rest.
Yes. that's we really we're really proud of our clinical students. They in the clinic now, it's different than classroom. It's different than they practice on each other as a student. They're dealing with the real patients. And so here it goes. If you don't do a good job, if it doesn't work, patients are not going to come back. So the clinical experience is a very important aspect of training for our students. Our students start clinical observation in their second term. So here at our DACM program, the clinical training is divided into 4 levels. One is the observation, and then the guided practice, the intermediate practice, and ultimately the advanced practice. So as the name it says, it increases, it goes in an increment of responsibilities. Students start with observing because they're still very early on in the curriculum. They can only observe and absorb what they're learning in the clinic, what they're learning in the classroom, and put it all together. And then they will start with their guided practice in the second year of their curriculum. That is a little bit more of a handheld from their supervisors, and at that time, everything they do will be under the close supervision of their clinical supervisor. And then moving on to an intermediate practice, meaning that they have a little bit more of freedom, but still most of the time being supervised. And then toward the end of their curriculum, when they're about to graduate, they will have what we call advanced practice. At any time, it is the supervisor are always there for them, and it's just an increase of responsibilities that the students have, but in no given time, they can just go ahead and treat a patient. We are very strict about that. We are responsible to our patients. We make sure that our students are doing the best thing and the right job under supervision. Just giving handheld, release a little bit more as they go.
Thank you for that. I'm getting some more questions. This is really great. I think of all the webinars we've ever done, this is the most questions we've had. So thank you all for sending those over. Well, again, I really encourage you to set up an appointment with the admissions office if you have a lot of these, because we really want to help create a customized enrollment plan for you, and based on how far away we are. Right now, as the recording of this, we're in April, and our next start and our only start this year is going to be or as of the plans we have right now, are going to be this fall. That's September 4th. So I have somebody asking about, what's the application deadline, and can you submit documents after the deadline? I would really encourage you to go ahead and apply right away. There's not necessarily an application deadline, but we do find that it takes a lot longer than you may think, not to do the application, but for you to get all of your transcripts in from your various universities you may have gone to. Can take a lot longer than you may expect. And also, once you get those in, we then have to evaluate the transcript. Then we schedule your interview. And so it may take time before we can work out schedules. Once we get that, we then we review that for acceptance or denial. If accepted at that point, then there's the deposit payment. And so you have to get that in. So there are a number of steps to take. So we just really always encourage students, don't wait. It's a 5 to 10 minute thing. And if you do it, or 10 to 15 minute maybe, application, and we're waiving the fee today. So use that all caps code waiver, and I would encourage you to go ahead and do that as well.
That's a great deal, waiving the fee.
Good deal. Okay, and we'll get back to those other questions after. 2 other things I'll highlight real quick before we go is that after graduation, not only are there great job opportunities, but by sitting side by side, you're learning and getting to know. You're not just building a family with other acupuncturists. You're going to have friends and family members who, in a way, that are chiropractors, physician assistants, and massage therapists. And so it creates a great network for you. And that's, I think, important to know. In almost every major city across the United States, and on almost every continent, we have alumni from our various programs. We also have a very good postgraduate offering. So if if you are an acupuncturist, depending on what state you're in, there are different requirements you have to complete of different classes and things. And we have great things like health coaching, nutrition. We're starting up a clinical genomics program that will begin this summer. We also have things like yoga foundations for healthcare professionals and many other opportunities. And over the years, we're going to be adding to those. So if you're listening to this now, and 3 years from now, by the time you finish your program, there'll be many, many more that are even more specific to acupuncture and herbal medicine as well. So just wanted to highlight that. Anything else that you would say before we finish up?
I would say that, you know, every accomplishment starts with a decision. So if you're thinking about it, if you're thinking about what you would like to do, would you like to contribute to helping people? And so don't wait, you know, you just go ahead and contact us and we can help you to evaluate your eligibility, or if not, what you need to do to be eligible. So don't let this be just a thought. Let this be an action and join us in making a world of difference.
That's right. Well, thank you very much, Dean Yu. With that, that's a great word for us to close on. Just making a difference and helping other people is really what it's all about. So thank you all for joining us. This will be up on YouTube. And again, please go online if you want to learn more, scuhs.edu/DACM. You can go there and learn about the program. Also, just email us, admissions@scuhs.edu, and we would love to set up an appointment and answer your questions. Also, make sure to keep an eye out on YouTube. We have a lot of webinars coming up. And if you haven't been here for one of our campus preview days, they are wonderful, exciting, and really fun events where you get to go and get to see different demonstrations and hear different presentations and meet some of your potential future classmates and that kind of thing as well. So thank you again, and we'll see you at the next webinar.
Thank you. Bye-bye.